favorite dentist, Dr. Amuko Emmanuel of Marvel's Dental Hospital, again with an informative video. Today, there's an important question again. Is dental treatment safe during pregnancy? I'm sure you have had this question yourself, or somebody you know has had this question. And if you're a dentist, obviously you have had this question several times. So, I'm going to address it head on. But before we answer that question, please make sure you subscribe and hit the bell such that anytime we upload a new video, you'll be the first one to see. Be informed. This is like your free dental school. Anyway, is dental treatment safe during pregnancy? The general answer is yes. As a matter of fact, it's not only safe, it is highly recommended. Now, before we get to treatment during pregnancy, we actually recommend that dental treatment must be considered as an important part of antenatal care. In fact, it must start before pregnancy. If you are intending to get pregnant, seek in advance dental treatment. Go visit your dentist, have a full, proper assessment of your dental or oral health in general. The reason for this is simple. Should you get a dental problem during your first 3 months of pregnancy, you will have a real challenge. Because at this time, a lot of things are going on. Hormonal changes are occurring, and this comes with so many other things, including things like tendencies to vomit, hating smells, morning sickness, and many others. So, if you seek your treatment early before you get pregnant, then most likely there's no chance that you're going to have a dental problem in your first 3 months of pregnancy. So, what are the things we recommend? Everything that you may need. If it is scaling and polishing, please have it done. If you have cavities, have them filled. If you need root canal, have it done. If you need scaling and polishing, have it done. Even if you need implants or oral surgery, anything you need in dental, best time to have it is before you get pregnant. But if you realize that you have a dental problem when you're already pregnant, don't worry, you can still be antenatal. The only advice I can give you is that make sure the dentist attending to you is competent and well trained. And by the way, somebody might be asking right now, why should I believe in that that the treatment is safe? Okay, this is a simple thing, and the simple reason you should believe me is this: I have been practicing dentistry since 2010. Yes, 11 years. So you can bet that I have seen lots of mothers with dental problems, and we have actually worked on them, hundreds of them. In fact, I have seen more than 10,000 patients altogether. So you can, even if it was 10% of those are mothers, that's at least 500, 1,000. But the point is this: it is safe and it is highly recommended. The only challenges are with the pregnancy itself, not the dental treatment. However, in the second trimester, that is now after 3 months and up to 6 months, this is the best time. If you find challenges having your treatment early in the first 3 months, you can have it in the second trimester. Now, the reason why we say that this is the best time is that the risks are reduced. The baby has already developed, so you are not worried about x-rays, and morning sickness has gone, the nausea is gone. So that's the best time. Also, looking at the other side, there are other difficulties which come when the pregnancy has crossed 6 months. We shall talk about the risks and the difficulties next time. But for now, what I want to say is that before those other challenges come in the second trimester, you can have all your treatments done there. But you do not have to wait. Another thing I realize is that most times when people ask this question, they are not generally referring to things like scaling and polishing. One thing they are concerned about is dental extraction. Well, in dental practice, actually, if you need dental extraction, that is considered an emergency care point. So, with emergencies, we do them at any trimester as long as it is indicated. Indicated means as long as it is required, it's necessary. Okay, here is the thing. Why would you want to keep a tooth which has bacteria in your body to keep on multiplying the bacteria? Because you are pregnant. Because you are worried that the extraction is going to harm your baby. Which, by the way, it cannot if it's done properly. And then you leave the infection to progress, and actually that bacteria can end up in your bloodstream and do what you intending to prevent, that is to harm the baby, because that's the worry of most mothers of the baby. So please, if you are pregnant, just make sure you get a competent service provider, a person who has done that and knows what to do, and then you will be safe. Dental treatment will be safe for you. It can be done safely. You don't need to die with the pain. So in our next video, we are actually going to handle the actual challenges, the difficulties, and the risks involved with dental treatment in pregnancy. Please make sure you don't miss that video. And if you haven't subscribed, please subscribe and hit that bell button so that when we upload that video, you are going to watch it. It is not about the myth, but we are going to separate the facts from fiction so that you know. And also we shall talk about what to do so that the risks don't occur. Thank you for watching this video, and please don't forget to subscribe. See you next time.